My name is Mark Gomez, and I'm a board-certified internal medicine physician. We are going to review health metric collection in the office setting. As a practicing physician, it is wise and important to follow EndoBalance's standardization collection guidelines for retrospective studies for individual clinics as well as for the network itself, as we strive to continue to improve health outcomes for all. We're going to start with waist circumference. Every visit is an opportunity to talk with your overweight and obese patients about weight loss. As such, waist circumference measurement is often used to identify patients with high risk for overall health complications of obesity. It serves as an indirect measure of central adiposity and correlates with visceral fat assessment. It has been known that excess abdominal fat is an independent predictor of overall morbidity. As such, men with waist circumferences greater than 40 inches and women with waist circumferences greater than 35 inches fit the criteria for immediate lifestyle intervention. As related to body mass index, measuring waist circumference is only necessary for BMI less than 35, as we know that BMI greater than 35 in an individual would already exceed the aforementioned waist circumference measurements.
Waist circumference. Description: a crude assessment of insulin resistance, lifestyle stressors, and dietary sugar intake. General weight circumference for individuals less than 6 feet in height should be less than 40 inches in males and less than 35 inches for females. Direction: client stands erect, feet together, shoulders retracted, arms aligned to sides. Measure 5 inches below the xiphoid process. Indicate a marker hash. Align tape parallel to hash. Record circumference of waist. Hip circumference. Description: a crude assessment of aesthetics and hormonal balance. Direction: client stands erect, feet together, shoulders retracted, arms aligned to sides of body. Tape is placed on the maximal circumference of the gluteal area, the buttocks. Tape must maintain parallel alignment with consistent tension. Record circumference of hip. Shoulder circumference. Description: a crude assessment of anabolic, catabolic hormonal status and lifestyle stressors versus choices. Direction: client stands erect, feet together, shoulders retracted, arms aligned to sides. Measure 5 inches down the humerus bone from tip of the acromion process, where the scapula and the collarbone intersect. Indicate a marker hash on each side. Align tape parallel to hash. Record circumference of shoulders. Tape must maintain parallel alignment with consistent tension. Neck circumference. Description: a general assessment of obesity, thyroid, cardiovascular, and sleep apnea risk. Direction: client stands erect, feet together, shoulders retracted, arms aligned to sides. Neck must maintain neutral position with chin slightly retracted, with chin slightly tucked in. Measurement is taken at the base of the neck.
We're now going to look at how anthropometric relationships impact wellness ratios. Anthropometric data helps you understand that how you look is tied to glandular function. An individual cannot have low wellness ratios, yet look ideal. Those who do not take medication and have ideal wellness ratios also have optimal longevity indexes. Note, appearance is secondary to glandular function as it takes time to restore nutrient deficiencies. This slide illustrates the relationship between appearance and glandular function. As an individual's appearance negatively changes from the ideal hourglass figure to the barrel shape in which the waist circumference moves outside the shoulder and hip ranges.
Waist to height ratio. Description: defined as the waist circumference divided by the height. A measure of blood sugar control and distribution of body fat. General aesthetic attractiveness measurement. Optimal blood sugar management and reduced visceral adiposity risk. The ratio should be less than 50% of height. Waist to hip ratio. Description: a crude assessment of insulin resistance, fat metabolism, hormonal balance, and ideal aesthetics. Shoulder to waist ratio. Description: a crude assessment of hormonal balance and ideal aesthetics.
This is the pictorial of an ideal BMI, body fat, and anthropometric ratio. The top triangle represents the shoulder to waist ratio. The bottom triangle represents the waist to hip ratio. and the triangle intersection point represents the waist-to-height ratio. This is the classic hourglass shape for maximal aesthetic attractiveness. In the stage 1 individual, one will see free fat mass decreasing and body fat slightly increasing as the individual becomes more and more dysregulated. In addition, hormones become dysregulated and insulin and cortisol levels will begin to increase. This condition prevents clients from adequately breaking down fat and maintaining muscle tissue. In the stage 2 individual, hormone resistance is now progressing and aesthetics are noticeably compromised. Clients may be experiencing a wide spectrum of symptoms. Waist-hip ratios are 1 or greater at this point, and body fat is approaching or in unhealthy ranges. Finally, stage 3 individuals will exhibit the pronounced barrel shape. In this stage, the client's wellness program must focus on pain management and corrective exercise. Lifestyle recovery practices are now recommended, and lifestyle recovery practices are recommended and then reduced as glandular health improves. In closing, exercise intensity can be increased as the client progresses into the lower stages.